Hi guys, it's Eric Cressey. Today we're going to talk about one of the assessments that we use with all of our throwers, and it's an assessment that we place a lot of faith in simply because the research really validates it. Believe it or not, there was actually a study last year that showed that having a shoulder flexion limitation on your throwing arm of more than 5 degrees increased your risk of elbow injury in the subsequent season by about 2.8 times. So it's actually a perfect illustration of the kinetic chain concept, where we realize that a shoulder problem, which really is directly related to a scapular control issue, a thoracic spine issue, or a core positioning issue, can impact an elbow. So we want to talk a little bit about the functional anatomy behind all that, but more importantly, first we need to show what the actual assessment looks like. So when we want to assess shoulder flexion range of motion, it's important to start the athlete in supine, hips and knees flexed, lower back nice and flat with the ribs down and the pelvis kind of tipped back so that I can't get my hand underneath here. Christian's got quite a bit of range of motion, so he's going to show us what a perfect shoulder flexion test would look like. You'll see he's able to get his arms pretty much flush to the table without his ribs really flaring up. So he does a good job. Even when I push his ribs down, you'll see that his upper arm doesn't really come off the table. What's not uncommon to see, though, is folks who come in with an asymmetrical or a bilateral shoulder flexion deficit. So you'll often see guys who are very limited and will just kind of hang out here on their throwing shoulder, particularly at this time of year when guys have accumulated a lot of innings and are a little bit beaten down. So there are a lot of reasons that you can be limited in this assessment. It could certainly be something that crosses the shoulder joint itself. It could be your lat, it could be your teres major, it could be the long head of your tricep, it could be your inferior capsule. It could also be muscles that impact the scapula. You have your pec minor and your coracobrachialis, the short head of your biceps that basically may limit your ability to posteriorly tilt. If you're someone who's really rounded over, a lack of thoracic spine extension could limit this. But I think the big player that we usually encounter is latissimus dorsi. So we're going to have Christian show up just so we can kind of speak to the functional anatomy side of things. And Christian's actually a good example because he is a right-handed pitcher and has a little bit of that lower shoulder. What we know about your lat is it attaches down in your thoracolumbar fascia, and then it works its way up towards your shoulder. So it's going to come up and have an impact on your rib cage. In a certain percentage of the population, it actually attaches on the scapula, and then obviously it comes through and it attaches on the humerus. So in addition to the impact it has on your shoulder, okay, it extends your arm, okay, it also adducts your arm, and on top of that, it internally rotates your arm. So it's very important, obviously, in terms of transferring force from the lower body all the way up to the arm in a motion that's internal rotation dominant, like throwing. Okay, so lat recruitment is very, very high in pro guys as compared to amateurs, and that's because we get more efficient as we get older with our mechanics, and we learn to use big muscles to do big jobs. What we need to appreciate, though, is that we need to be able to turn our lats off when we don't want to use them. So if you think about where most throwing injuries happen, whether we're talking about a slap tear, cuff irritation, biceps tendon problems, or an actual valgus stress-related injury at the elbow, which could be a flexor pronator injury, a UCL tear, ulnar nerve irritation, they really happen at that position of layback, when he externally rotates his arm and transitions from cocking to acceleration. So if we think about this pattern, it really directly competes with what your lat does. Your lat basically pulls you down in a grand sense. It pulls you into scapular depression, it pulls you into an arch back position. What we need to do is we need to upwardly rotate, we need to take our arm up here. Okay, our arm needs to abduct, it needs to flex, and it needs to externally rotate. So if you have a lat that is really, really dominant to the point that it's actually limiting shoulder flexion, chances are it's forcing you to find a different way to get your arm back in that layback position. So it may come from extra lumbar extension. It's where we see stress fractures, low back pain in some young athletes. It could be that you're cranking into a lot of scapular depression, or just making the most of every little bit of thoracic extension you have. Or it could be a guy who has to roll forward and irritate the front of his shoulder and blow out his anterior capsule in order to get his arm back. Or what we see very, very commonly is we see guys who just crank at their elbow over and over again and wind up with some kind of soft tissue injury or ligamentous tear on the medial aspect of the joint. In a young population, they may actually get some compressive problems on the outside here. So their inability to turn off their lats so they can get true layback is a big problem. Okay, so one of the things that we really need to assess is we need to make sure that guys aren't just going out and throwing if they have a very limited shoulder flexion on that throwing side. We need to either transiently do some soft tissue work, do some positional breathing exercises, give them some mobility exercises before they pick up the ball and start to throw. Or we need to look at it from a chronic standpoint and say, hey, what can we do from a postural modification standpoint? Maybe we need to stop letting them shag BP while they're standing around the outfield like this all the time and drive like this. We need to get away from those patterns that feed into this low shoulder and limited shoulder flexion. This is also a great example of why you see a lot of throwers who will actually blow out their elbows early in seasons. Because they haven't acquired all their external rotation back after the layoff, they have to go to other patterns to get back. So if you're limited external rotation at your shoulder, you're going to crank more at the elbow to get back. So it may not be because of the lat dominance really kicking in at that time of year. It may be because the capsule's stiffen up in the front and they can't quite get back. But the important thing to realize is that there are all different compensations along the kinetic chain with throwing. If we don't move right at our shoulder, we'll certainly throw our elbow under the bus. But just because you see a limited shoulder flexion pattern doesn't mean it's always going to be an elbow injury. It could be a slap tear, it could be biceps tendon irritation, it could be a stress fracture in your low back, it could be a number of different things. So it's very important to address that if it is a problem. And at this time of year, like I said, it is a big problem for a lot of guys who have accumulated a lot of innings.